Welcome back to the Osteophysio YouTube channel. Today's video we are looking at why am I getting pain around the front of my chest. As always, we're going to be speaking about the most common musculoskeletal causes of pain around this area. If you are experiencing chest pain, of course, go and get it checked by the GP first. But we're going to be talking about the most common mechanical structures that can trigger pain, achiness and soreness to be transferred into this area. So let's have a think about the anatomy. So what have we got around this area if we're thinking of pain here? We've got our collarbone, our clavicle coming across here, our sternoclavicular joint here, so where the collarbone meets the sternum. We've also got the acromioclavicular joint, so where the clavicles meet in the acromion of your shoulder blade, of your scapulae. And then we've also got ribs coming around the front and attaching into the sternum here with these sternocondral joints and the costochondral joint slightly outward. So lots of different bony structures here. What we've also got over the top are lots of muscles attaching down and attaching across. So some of the most common causes of pain around this area initially might be dysfunction, inflammation or pain on these main joints. So if we're thinking about either the sternoclavicular joint or the acromioclavicular joint, it's normally worse on shoulder movement. It's very localized, normally quite pinpoint, quite sharp into that movement, into that joint. It might be as they're reaching across or leaning forward, anything that compresses the joint together across the body, so reaching across. So we're thinking to put a seatbelt on, that might be triggering pain into those joints. What they typically find is if they're holding the arm and they're resting, it normally makes us feel a lot more comfortable. What we can also get if we've had any kind of coughs, colds, sneezing fits or any kind of trauma directly into the ribs, if we've had like a seatbelt injury into this area, that can compress, aggravate or inflame the joints around the ribs. So people either report quite a deep ache into here and they almost point into that middle part of the chest, or they might be coming slightly outwards, and what they find it's normally triggered either on shoulder movement or back movement as you're moving the ribs. But typically as we're breathing in and out, this might be making the pain worse, and a lot of the time they might be bracing through the ribs to help with that pain. So with any of these conditions that are triggered by the joints, what we'd be looking for is we'd be testing the joint range of motion, looking at the breathing if we're thinking about the ribs, but also we'd be looking to see, okay, there might be pain or dysfunction in those joints. What are the surrounding structures doing? So this is also really important. So other things that can cause pain into this area, if we're thinking of the ribs first, might be the intercostal muscles, the ribs, the muscles that sit between the ribs that help with that breathing. And what someone might suggest or they might indicate is that there's tenderness between the ribs, almost like they can follow the muscle outwards. It normally feels quite achy, quite sore, and can be quite painful on breathing. If we're also thinking of the big pec muscles that come across, sometimes it can be like a dull ache going across from the shoulder, and not normally a lot wider surface area, whereas the intercostals are very specific, normally between the ribs, and it just feels like a dull ache. So any reaching back or reaching out to the side, that can pull and cause tenderness into those pec muscles. So the pain source is either going to be a myalgia, like an ache in the belly of the muscle, or there might be trigger points, so knots in these muscles that might be causing really specific pain and tightness to form in that area. Next, we want to think about some of the other musculoskeletal structures that might be impacting that pain. So next we want to think about subclavius, which is a tiny muscle sitting underneath the collarbone. It stabilizes your collarbone, your clavicle on shoulder movement. So if you've done anything where you've been dropping the shoulder forward or any repetitive trauma or repetitive movements through that area, you can get a really deep, horrible ache underneath that collarbone that can just be really tender on palpation. What we also want to think about is some of the neck muscles attaching around here, as they can also refer down into the chest. So thinking about your SCM and your scalene. So if you've had a cough or a cold, or just general posture where we're fixed in this position, they can become quite tight, quite sore. So what happens is we end up doing like upper rib breathing, so we might not be breathing properly. That can be overused, can become very tender. So it's either going to be insidious, maybe building up over time, causing pain here, which sometimes refers down into the chest, or it could be post-whiplash injury where the head's been pulled or the head's been moved, and that can refer tightness into here, which can go into the chest. But also commonly with those muscles as well, you typically get that associated pain over the head, over the side of the face. It can be quite an unclear picture of pain with lots of different areas being sensitive. Finally, we want to be thinking about something called thoracic outlet syndrome. So it's where your brachial plexus, which are the bunch of nerves that exit the neck, that go down into the arm to supply the muscles and the skin and the joints all around the upper extremity. They pass out of the neck, they pass through something called your scalene triangle, around underneath the collarbone, around the pec, and then down into the arm when they bifurcate and change to supply different areas. So you think if you've had trauma or tightness and you've got it in your neck and you've got it in your chest and everything's kind of built up, it's very common that someone might get tingling into the hand or numbness or weakness associated with the ache in this area. So you normally get the dull ache into the chest, but individuals also reporting tingling coming on and weakness in association to the pain. So what we would do in clinic is a really thorough neuroscreen, so testing, okay, which nerves are involved, where is the weakness, if there is any sensation changes around the skin, pushing and testing very gently over the areas where that could get compressed from the neck all the way down into the hand, and having a look to see what might be triggering your symptoms.